Good afternoon, this is Dr. Brett, and I wanted to talk about today conventional medicine versus alternative medicine. In quotations, I want to define, compare, and contrast these different types of medicine, and I consider that this may be one of the more important videos that I will make. So, first off, conventional medicine. This has some different names. Let's get on the same track here. They'll say conventional medicine, allopathic medicine, mainstream medicine, or sometimes it's called the medical system. And it's also called Western medicine. And all of these, for one reason or another, I consider to be either vague or a poor definition. They're not really very good words to describe what it is. A better name is biomedicine. Okay, so biomedicine is the word I'm going to use to describe that field. What's involved in biomedicine? Well, the biomedicine lineage goes back to Hippocrates of ancient Greece. And Hippocrates said, "What medicines do not heal, the lance will. What the lance does not heal, fire will. And what fire does not heal is incurable." And in general, that does to some extent describe the medical profession. They're going to be mostly about using pharmaceuticals and drugs, surgery, and burning would be like radiation. Okay, so these are some of the main tools of the medical profession. Now there's going to be overlap between alternative and conventional medicine, and that's fine. I'm just trying to define two different philosophies or points of view here. Okay, so let's talk about alternative medicine. I don't like the name alternative medicine because sometimes I'm lumped in that category. I don't see it as an alternative. I see it as frontline, a good place to start in most cases, very often times. So other words are complementary in alternative medicine, or CAM. Not so much as a profession, but it might be called folk medicine, homeopathic medicine, holistic, or oftentimes it's called Eastern. So I want to call it subtle influence medicine. Now this isn't a well-known term, but it is the term that describes it very well. It's subtle influence medicine. And historically, it's been about subtle influences. So sound, light, touch, radiant energy. It's actually, there's two types, if I would put it in broad categories. There is a subtle influence medicine that comes from the East, which is like Chinese medicine, Ayurvedic medicine, acupuncture, those types of things. And that's not what I do. I'm a naturopathic doctor, so I come from a Western subtle influence medicine lineage, and it is a product of the Enlightenment movement in the 1700s. So I consider it to be very scientific. It's been scientific from the very beginning. There's a tremendous amount of scientific evidence for these methods. And so it is evidence-based, which one of the attacks against it is that it's not. Okay? So some examples of Western subtle influence medicine, and this is just a few examples. There's really a lot of rich diversity in Western subtle influence medicine. I'll talk about my naturopathic training. It had several modalities in it. It's very eclectic. So we learned similar to chiropractic techniques, or bone manipulation. It's called naturopathic manipulative therapy. We learned some muscle techniques, but in general, massage is subtle influence. Homeopathy, Homeopathy is a specific type of medicine. It's not a good umbrella term for Western subtle influence medicine. And the term allopathic medicine was given by the same inventor of homeopathy, Samuel Hahnemann. So that's really not the best word to describe biomedicine either. So other things, we learned hydrotherapy and nature cure in school. We learned nutrition, herbs, mind-body medicine, and lifestyle. Some might go into things like hypnotherapy, but those are just examples of subtle influence medicine, and those were part of my training. Now, I use, I would call it a more evolved method. It brings a lot of things together. It's a lot more recent, within the last 45 years or so. It's total body modification in my practice. And it just brings a lot of these techniques together. But let's get down to the nuts and bolts. What makes these two, biomedicine and subtle influence medicine, what makes them different? And in a nutshell, biomedicine is very direct. If you've got bacteria that are harming your body, they'll give you an antibiotic. If you have hypertension, which is high blood pressure, they'll give you an antihypertensive. Okay, it's very direct. If you have inflammation, they'll give you an anti-inflammatory. It's going directly right after the pathology. Well, good and true subtle influence medicine doesn't typically go right after. It's not a direct approach, it's actually an indirect approach. So, for example, you've got a bacterial infection. Let's say it's in your gut. Well, they might say, well, there's an imbalance in your gut. There is, you don't have enough good bacteria. Maybe you weren't breastfed. Maybe you did get antibiotics and it killed a lot of the bad bacteria. Maybe you don't have enough stomach acid to prevent new infections. Maybe you don't have enough iodine. So we're looking at an indirect approach. Why do you have this? And it's a really way of getting to the root cause of what's going on. Why do you have this problem? Why did you get it in the first place? It takes a longer time to get there because it's indirect. I think one of the reasons that biomedicine has such appeal, why it's so widespread, is because a predecessor to biomedicine was called heroic medicine. You just get in there and you have this heroic effort, this heroic medicine, and it gets the job done quick. And one thing I was feeling about it recently is it's like people want a shortcut. They don't want to have to deal with what's going on. We just want the results, and we want them now. We want the solution. And I'm not against biomedicine, by the way. I want to make that really clear with this video. I was going to call this video conventional medicine versus alternative medicine, but I didn't like that because I don't see them as opposing. I don't see them as one's good and one's bad. It's really about the way that they're used, when they're used, because they both have tools that need to be used appropriately. Now for me, if I have to use drugs, surgery, radiation, it usually means I haven't done a good job to the point where we need that heroic medicine, that really strong influence coming in. It means that I didn't do a good job. I didn't take care of the problem before it got that bad. So ultimately, with subtle influence medicine, like I said, it's an indirect route, and I talked about a lot of examples with the gut, but I really am a proponent of the philosophy that it's all going to go back to the nervous system, and it's kind of a chiropractic principle. I've been trained by chiropractors, several chiropractors, as well as naturopaths, And ever since the Age of Enlightenment, this Western subtle influence medicine lineage has kind of been about the nervous system since the beginning. And the goal is, if there's disease, it's a problem in the nervous system. We want to create the cure as a profound neurologic change. Okay? So a lot about subtle influence medicine is giving the body a nudge and getting it back on track, because the body can regulate itself. So it's kind of about trusting the body, supporting the body, giving it what it needs in order to function properly. Okay? I'd love to have a great discussion about this. If there's any questions, or maybe you have some critiques, you don't think I'm right about this. Like I said, I think there can be overlap. There's some great medical doctors and osteopaths who will use lifestyle, and maybe they'll even use some nutrition and different things that can work really well. And it's important to note that there's also naturopaths and chiropractors and people who are using a biomedicine approach. They're going after the disease directly. They're using, sometimes we use the term green allopathy. They might use herbs in the same way that drugs are being used. They're not really going after the root cause. They're just trying to fix it. And there can be a lot of pressure on us as doctors to do that. People want results and they want them quick, and they might not want to put in all the effort it takes to be a healthy person. But in my circle we have a saying. We say shortcuts aren't. Basically, that just means there's no such thing as a shortcut, especially with your health. There are kind of natural laws that govern the body, and those laws, they can't be cheated, they can't be averted, it can't be bypassed. Shortcuts aren't. There's no such thing as a shortcut with the body. You're going to have to take care of your body through diet, through lifestyle, getting good rest, getting fresh air and sunlight, and you have to take care of your body. Okay? So I think that covers what I want to cover for now. So again, so that's biomedicine, which is oftentimes called conventional, mainstream medical. It's the reason I don't like it called Western medicine is because what I do is Western medicine. Naturopathy, you cannot really draw it back to an Eastern tradition. A lot of naturopaths will include Eastern traditions. Chiropractic is very Western. A lot of these different modalities that we see, these different systems, they come from the West. They don't come from the East. So that's why I call what I do Western subtle influence medicine. It is holistic in nature, but holistic isn't really specific enough. I'd say a good biomedicine doctor, they might be thinking holistically. Okay? So that's it. Glad to share that with you. Cheers.